Welcome to ReMend Renal Roundtable. Today's episode is for anyone who's heard dialysis might be coming or who's facing big kidney care decisions and wants straight answers without the overwhelm. We'll tackle the questions people are often afraid to ask, clarify what really matters, and share practical ways to advocate for yourself so you can make decisions with confidence and not pressure. Also, this is for general education purposes only. Please bring your personal medical decisions to your care team. I'm Kiku Boyens. I'm the executive director for ReMend, a nonprofit peer-to-peer mentoring community for people navigating their kidney journey. I'm also a 23-year kidney transplant recipient, so this work is deeply personal to me. I'm joined today by Jean Marie Ferguson, a 2-time transplant recipient, patient advocate, and passionate voice in the kidney community. With nearly 2 decades of lived experience, Jean Marie works with ReMend, Transplant Life, and Life Sharing to help others feel informed, supported, and less alone. Our special guest today is Dr. Mark Boiskin of Balboa Nephrology. Dr. Boiskin has cared for patients since 1999 and sees patients in La Jolla, Poway, and Encinitas. Along with his work in kidney care and dialysis, he's also involved in research with Balboa Research. His journey from South Africa to Canada to UC San Diego has shaped a thoughtful and well-rounded approach to patient care. We're so glad that you're here. So let's dive into today's conversation. Marie?
Thank you. Thank you, Dr. Boiskin, for being here today. So the first question I have for you, since I am your actual patient, is a special question. What does a prepared patient look like to you?
Well, first of all, I'd like to thank you, Jean Marie and Kiku, for inviting me here today. I feel it's a real privilege for me to be able to speak to you and ReMend, people signing into ReMend to watch this program today. I'd also like to mention that I am giving general recommendations. These are not specific recommendations for any patient, and every case is different, and only your own nephrologist can make those decisions with you as to what your best care will be. So let's start. What is a prepared patient? Well, when someone's diagnosed with chronic kidney disease, it's usually a shock, and many people don't really know what that is. Everybody knows about heart disease and cancers and kidneys. Many people don't even know where the kidneys are. So what is a prepared patient? First of all, get the information from your doctor. And then, of course, you can go online into the internet. Many patients will use Google or now ChatGPT and that. But be very cautious when you use those and be sure that the recommendations that they are giving you pertain to you. They're also giving general recommendations, and they don't always mean that they will be of benefit to you. For example, they will say patients need to drink a lot of water. Well, which patients need to drink a lot of water? Dialysis patients, patients with transplants, patients with chronic kidney disease, patients with heart failure. Who are they talking about? I think that's very important. So you need to be prepared to ask your doctor specific questions, especially with regard to recommendations you have been given by other people, and especially your expert friends who seem to know a lot about things, but maybe not specifically your case. So be cautious about the information you get from other sources or sources other than your doctor. So a prepared patient should be, first of all, ask your doctor, what does this kidney disease mean to me? How far have I progressed? What are the causes? What restrictions do I need to make? I've seen, patients will say, well, you've never told me to restrict my potassium, and I'm a chronic kidney disease patient. And why have you never told me that? Well, you don't have a potassium problem. You actually have diarrhea and small bowel syndrome. And if you restrict your potassium, you're going to have a cardiac arrest. So be very careful of those non-specific recommendations. So, those are good questions to ask your doctor, especially recommendations from other people and general recommendations that you will be given online and by friends. And if they really mean specifically in your case that they're important or not.
That's great. I'm glad that you brought up the AI tool, because I try to tell people to use it as a tool to help them generate questions and not use it same with whatever they're reading in like a Facebook forum or things like that, to just help them guide questions to their doctors.
Mhm.
Right.
What information from a patient helps you take care of them faster?
It's frequently after I have given them the information about their kidney disease, um, and their symptoms, what they're experiencing. That's very important for me to know. As I tell patients, my evaluation of them starts when I walk through the door. So even if they haven't even said anything to me, just their observation, their demeanor, are they short of breath? Are they comfortable? Are they anxious? It's important. And that's why telemedicine is not always the best way, especially for me and my evaluation of complex patients. So it's important for me to know, number one, that they're taking their medications accurately and not say, oh, nothing's changed. And then we find out that many things have changed. Medication errors are common and can be absolutely devastating. I need to know, obviously, how they feel, their day to day life, day to day things. How's your mood? How's your energy levels? And then, of course, how's your breathing? How's your appetite? And daily functions, if you like. Those things are important for me to know. How am I feeling about my kidney disease? What's the future going to hold for me? How I've discussed this with family members. Those things are all very important for me to know and to understand, and to have family members come with patients. Sometimes not always for the first visit, because we're concentrating on data information and exchange directly with the patient. And that can be a little bit disruptive if some patients, family members, want to know certain things. Sometimes it's fine if they come, but then they really need to know I'm concentrating on the patient. But certainly after that, I encourage family members to come in. I encourage family members to be part of the team taking care of my patients. So that's very important for me.
Thank you.
I love hearing that, right, Jean Marie?
Yeah.
I mean, I sometimes get the impression that physicians may not appreciate having a family member there or somebody there or someone recording their visit. So all of those things after the first visit is probably a good thing,
I think so.
right?
And certainly encourage. Initially having to be recorded as a physician, it feels a little awkward when family members are recording you. Sometimes for the first visit, I don't want any distractions. Then I sometimes will forget to ask an important question because I'm a little distracted in that. But as I say, after the first visit, I don't have any problem with being recorded, multiple family members. Sometimes young kids can be a little bit, distracting, but it's still important. I mean, some patients will come in, they don't have care for their kids at home. They, so they have those issues, and we really try. I think physicians need to be understanding that these are people with real lives outside the doctor's office, and if they can't
Mhm.
find care for their kids and their kids are a little disruptive, just be patient. Please be patient. Ask them, maybe we can talk on the phone afterwards. You can text me. We can clarify certain things. But I try and still do the best I can with, even little kids that come into the office. And it is a family situation having someone with chronic kidney disease. And I think it's important that family participate in the care of their loved ones.
Yeah.
That's great.
Sure.
Thank you. Um, what do you wish patients asked sooner, like before symptoms spike or a crisis happens?
One of the questions that I find, that patients have in their mind, which is extremely anxiety provoking, is when will I need dialysis? And I know we're going to discuss a little bit about that. And, we now have ways of calculating, and we have these heat charts in the office and stuff, which can be very helpful. And remember that most patients that I see do not end up on dialysis. So dialysis, when they have chronic kidney disease stage 3 and they've got hardly any protein in their urine and they don't have progressive diseases, the likelihood that they'll end up on dialysis is so small, yet they are so anxious about it. And some of my patients will only ask me that 2 or 3 visits down the road, and they say, "Oh, I've been so afraid to ask you that. And I've been so afraid about my kidney disease. And I really didn't want to know about me ending up on dialysis." And I say, you're never going to end up on dialysis. So it's, well, obviously, unless something else happens, but for the most part, most patients with chronic kidney disease do not end up on dialysis. And I would wish that they would have asked me those questions sooner, because I don't always think to tell them that, because in my mind, it's a non-issue, but not in their minds. So,
Mm-hmm.
anxiety is a very bad thing. Anxiety is pro-inflammatory, and it's got so many other bad physical effects that you really try and reduce anxiety as much as possible.
That's good.
What do you wish patients knew about what you're balancing in a visit so they don't interpret any brevity as a lack of caring?
Well, I would like them to discuss with me their anxieties, their restrictions, their restrictions. Many of them don't have to restrict anything. Many of them are afraid to eat certain foods, certain things. I think it's mostly, from my standpoint, are their fears of how's this going to impact their lives, and what they need to do and what they don't need to restrict in their lives, so that they can live the best life possible for them in a safe way, without accelerating the loss of their kidney function, or impairing their joy in life, or taking away a lot of things that they would love to do but are afraid to do it because they have chronic kidney disease. So those are the things that I would, like to discuss with patients. Once again, their fears, their anxieties, and sometimes you'll have even family members will create that kind of anxiety and fear because they're fearful, they're anxious. So please have those family members come in with you, and we can discuss their fears and their anxieties, because they may put those on you. They fear you going to Hawaii, because what happens if your kidney suddenly attacks you when you're there? What's going to happen? Obviously I'm making this up, but that kind of thing, it's not going to happen. Go there, enjoy yourself, have fun. You can do all those things.
That's probably one of the top things I hear being a mentor, is that exact thing. Because I think patients forget to talk to their doctors, or they're scared to talk to their doctors about their fears, and it comes to the mentors. And so I hear it all the time. They're very upset about needing to change their diet, or, they're just very scared. And so that's good to know that they should be talking to their doctor about that.
And also the thing is that I tell my patients, you're not going to die from your kidney disease. If it's specifically your kidney disease, you need to look after your heart. So what's good for your heart will be good for your kidneys. So all these things that tell you, regular exercise, optimize your weight, eat good, healthy food, think of your heart, and it's not your kidney that's going to suddenly attack you. So just good general health, and you can look up cardiac diets, and good things that are good for your heart will be good for your kidneys. So, and I have many of my patients will be more afraid of their kidney disease than any cardiac disease. And, and I hear that quite often, actually. I'm so afraid of my heart. I'm not that anxious when I see my cardiologist, but I'm so anxious when I see my kidney doctor. And I'm still trying to analyze that, and thinking that, your kidneys is not, it is a concern, of course, because you can end up on dialysis. It increases a lot of your risk factors, but concentrate on your cardiac risk factors and you'll be good.
Do you think that's because there is so much attention towards heart attacks, towards, heart health, rather than information about kidney care? There's just, sure, you can find it online, but everyone seems to hear about heart health and breast cancer and things like that. Do you think that might be the reason, because it's the unknown?
That's exactly what I was going to say. I think it's the unknown, and that compared to those other diseases, kidney disease is not as common. And so it's the unknown and the complexity of kidney disease. I think it's a very complex disease to have. There can be many restrictions, many medications that you may need to take. Kidney disease affects so many different systems, from causing anemia, causing bone disease, accelerating cardiac disease. You may have diabetes on top of that. So it's a very complex disease to have, and there's so much to learn and new things to learn. My patients will say, well, why are you talking about vitamin D and extra things in phosphorus? And I'm talking about my kidneys. Why are you talking about my bones? Why are you talking about, this stuff? Well, the kidneys affect it, anemia, kidneys and anemia. What are you talking about? So a lot of people don't know that the kidneys are involved in so many other organ systems that I think it can be very anxiety provoking to many patients. And maybe that's what drives a lot of the fear of the unknown and how many other systems can be involved in kidney disease.
Mhm.
Yeah. Yeah, because when I think of kidneys, I just think that they're making urine. I mean,
Yep.
I know more now, but that's kind
Right.
of my initial thought is, they're just making urine. I'm fine.
Well,
I
it's
mean,
true.
they're,
When I talk to patients about their kidney disease, they say, what do you mean I have kidney disease? I pee just fine. I've heard that quite often. And it's like, what? But these are the facts. If you ask many people, out there, um, my kidney color's fine. Why are you saying I have kidney disease? These misconceptions and, uh, you know, it's a lot of things are more bladder problems than kidney problems and other
Mm-hmm.
things that people think if you're peeing fine, then you can't have a kidney problem.
I mean, don't you think people need to know you have a set of kidneys and they are pretty much the filter for everything that leaves your body, right? I mean, people don't, that basic information, basic kidney care education would be helpful. I mean, what do you guys think?
Jean Marie, you've been through it. What do you think as far as your knowledge goes from prior to having a kidney problem to afterwards? I mean, your learning curve is so steep after you speak with a nephrologist after your first visit or two, and what really is kidney disease and what may not be.
Yeah, I actually didn't really think about the heart health connection until maybe 5 years ago, maybe 6 years ago. Maybe it was a little sooner when I did switch my diet around, but I didn't have to see a cardiologist until way later. And then that's when he was like, oh, your cholesterol, everything's great, And so, what are you doing? I'm like, oh, it's my diet. So I never really connected it until actually probably when I started mentoring dialysis patients, because that's when I realized the things that they're doing along with the dialysis is really putting a lot of strain on their heart. And it kind of frustrates me because I'm like, oh my gosh, you could be doing all of these other things that could be taking care of your heart along with your kidney. And you see this in speaking with dialysis patients too, that they have heart attacks on dialysis and things of that nature. And so it all sort of just started connecting not that long ago for me.
Well, also you started having kidney disease from a very young age. I hope I'm okay to say that. So
Yeah.
the focus wasn't quite at that time on cardiovascular disease and atherosclerosis. It was more on, on other things and management of other issues. As you got older, it becomes more and more important. Certainly, you need to pay attention to that much earlier in life when you have chronic kidney disease as an additional cardiac risk factor. It should be considered an additional cardiac risk factor. So that should make you even more aggressive in your management of other cardiac risk factors, especially as you're, getting older. And that's
What I find,
older is not so old.
yeah, it's true. It is though. My knees hurt. How I'm wondering if it would be even more beneficial for patients to start seeing a cardiologist right at the same time as they're seeing a nephrologist, because I mean, I know how hard it is to get into other specialty doctors. Like he's GI, cardiology. And so once you're already having a problem, it's so difficult to get in to see some of those specialty doctors.
Absolutely. But you may not recall that when you had your first evaluation for your kidney transplant, you did undergo cardiac evaluation. And so they would have identified factors then already. So you actually did have, you may not think, oh, that was just part of my transplant workup. But part of the transplant workup is cardiovascular health. So you're already having it at that stage, starting off. But those patients that aren't transplanted, I absolutely agree. And I will tell some of my patients, it's probably time for you to see a cardiologist as well. So what do you mean? I'm still young, I'm not even 40 or 50 yet. And I say, let's just get a baseline, especially let's just get a baseline. And yes, I don't think you have a problem now, but let's get an EKG, let's get an echocardiogram, let's get your stress test as a baseline. What do you mean? I've got cardiac disease as well as no, it's just a baseline. If something happens in the future, we can tell your EKG is a little bit abnormal, but it's been abnormal since your 20s or 30s. Nothing to worry about. It's fine. You're not having a heart attack. Your cardiac function is fine. This is your baseline. You're still at baseline. I think that's very important.
Yeah. I mean, as soon as I started seeing the cardiologist a little bit more frequently, I kind of really started taking my heart health seriously. Even though I have nothing wrong with my heart, it's the only organ that's really great.
But
But
I understand what you mean.
it was great to hear that from the cardiologist saying, oh, exercising, even though I know the nephrologist says that, but hearing it also from the cardiologist, you kind of it all links together a little bit more, a little more
Well,
cohesive.
we're a team. Absolutely,
Yeah.
we're a team. And the more times you hear that, I think it's important. And as we know, doctors have many different beliefs and experiences in their life and their training and everything. And, as I sometimes tell people, you ask two doctors for their opinion, you're going to get three different opinions. So a lot of it is based on opinion and the doctor's experience, and their personal feelings about certain things. And I think it's important for patients to hear it from different doctors and even a second nephrology opinion. I know some nephrologists may get a little bit, wow, what's going on here? But if a patient, even thinks about it, I say, do it. You might get different information or information from a different perspective than what I'm giving you. And sometimes, especially as you were talking about, your transplant nephrologist, it's wonderful that you have another nephrologist also taking care of you. You get things from a different perspective. I might be your nephrologist, but you end up on dialysis, and then you have another nephrologist and you have a different perspective. I think that's absolutely wonderful. Even in the hospital, when you're in the hospital, why is my nephrologist taking off the weekend? I can't get through the weekend in the hospital without my. So, it's wonderful that you're now getting a second opinion. Another nephrologist taking care of you, they might tell you something a little different, and we can discuss it afterwards. But I think it's really good to have another nephrologist's opinion. And so, I think never feel badly about saying, I would just like to get a different perspective from another nephrologist, or just, and, if your nephrologist is comfortable with that and not insecure about their practice and their medicine, it should be encouraged. That's my opinion.
It's a great opinion because we've done that before where we're trying to figure out what was going on with me, and you called up another nephrologist, and together everyone figured out what was happening. So I always
Exactly.
tell people that that's one of the first things I look for in a doctor is someone who's willing and open to partnering with other people.
I mean, you could look at it as in a negative light, but I think that's a positive way of looking at it if you're in the hospital and you see another nephrologist. I love hearing that. That's really helpful to me.
Yeah, and I often will come back on a Monday and say, what did the other nephrologist say? What was their perspective? And it's, wow, really, maybe I didn't think of that, but that's great. We're a team, and you work with other nephrologists and doctors that hopefully my patients trust, and I trust to give my patients
Mm.
slightly different perspective. but everything for the benefit of the patient. It's, as a doctor, it's not about me, it's about the patient.
Yeah. What is the most common misunderstanding patients have when starting their dialysis planning?
Understand that it's very anxiety provoking, and dialysis has now become the end of my life. And I try and explain it's not the end of your life. It's just a different phase of your life. And I try and encourage them to incorporate it, that as part of your life, because that becomes your new way of living. And if you fight it and you miss dialysis and you don't, be aggressive about your health, taking your medications, following dietary recommendations, you're not going to do well. And I know for a while patients do still do well, but they don't realize that your problems are building up. If if you're gaining too much fluid, if you're not keeping up with your phosphorus, a lot of things like that. But if you take care of yourself, you acknowledge, you understand, this is not the end of my life. It's just a different way of me living. And well, dialysis is horrible and da da. Well, yes, we can look at it that way, or we can look at it, thank heavens, there is dialysis that I can continue living. And I sometimes hear, which kind of saddens me, that, oh, I don't want to go on dialysis because my uncle went on dialysis and he only lived 8 months and then he died. So I try and say, well, how long would he have lived if he never had dialysis? And then there's a pause.
Right.
Well, you had the ability to have your uncle and your loved family member or whoever it was 8 more months longer than what they would have had on dialysis. Yes, dialysis is not perfect, but it's not the end of your life. And it's a new way of life. And and we should embrace sometimes that we have the technology that can keep us alive for longer than we otherwise would have been alive. Once again, it's not perfect. We have a long way to go, but it does give people a number of extra years that they otherwise would not have had.
I
Yeah.
love that because I was on dialysis for almost 5 years, and I was young when I was on dialysis, and I just felt like, well, my perspective was just something I have to go through to get better. And yeah, it sucked. It was a completely, change of my lifestyle. But if you just, go in it with a positive attitude and not thinking, ugh, and it's easy for me to say that because I've come through on the other side of that of dialysis. But yeah, you can go in, with the dreaded vibe, or you can go in with like, okay, what can I do to stay healthy now that I have to, you know, endure this portion of my life. So I love hearing that. Again, it's just being positive. Also, again, you've mentioned this many times, but addressing your anxieties about dialysis, right?
Yeah. And incorporating in your life, the one time it really struck me was shortly after I came to San Diego. I was asked to do dialysis rounds. I still remember it was down south somewhere, a mission dialysis unit, I think, one of those. And there was a young guy, and he was always sleeping. And it struck me that he was so young. He was a college kid. And most of the other patients were a lot older than him, and he was always sleeping. And I would say to the nurses, this guy's sleeping. And they say, yeah, he always does that. He comes in, he does his 4 hours. He doesn't I said, does he complain about his time? Never. So when I eventually got to speak to him, he was a college kid. So he would study. He would go out and have his party after studying. He would be with all his college friends and everything. And he wouldn't sleep that much. And he'd try to get as early as possible dialysis time, like coming in, I don't know, it was a big dialysis unit. So they started very early, maybe 3, 4 o'clock in the morning. And then he would sleep for 4 hours and then he would go to classes. And if he was tired in the afternoon, he'd have a little bit of sleep. But he had made dialysis part of his life until he got a transplant. Now, if he had
Right.
fought that and had not gone to dialysis and had not incorporated it as part of his life, he may not have survived to get a transplant, because when you're young, you've just started college, you don't want to be thinking about dialysis and going to dialysis all the time, and your friends are out and you're stuck with dialysis or whatever. So he still went out, still enjoyed himself, and then he came to get his rest in the dialysis unit. And he did
Mhm.
great. He was a
Yeah.
nice guy. He wasn't angry. He did great.
Incorporated into his lifestyle.
Yeah.
Yeah. Is that one of the tips you would suggest for patients to help them feel more in control when they hear that dialysis is coming soon?
Yes. So the dialysis times, well, things are getting a little bit tight in the dialysis units, and you may not get the time you want. So if you get a time during the middle of the day, that's very disruptive, especially for patients that are working and that are studying, and that can be very difficult. So we try and work on getting either very early times or late times. Go do all your classes and stuff, come to the dialysis unit at 7, 8 o'clock at night and sleep, and then go home and sleep again. And during the day, you can go to all your classes, you can be with your family, you can go to all your studying and everything. So, we most patients don't think of that before they start dialysis. And certainly with peritoneal dialysis, you can change your peritoneal dialysis. You can have a lot of flexibility. You don't have to do all your exchanges in one shot. You can. I had a guy that worked, but there was a farmer, so he would get up, really early in the morning. So he would do 2 or 3 exchanges through the night. 4 o'clock in the morning, he would be up, and then by 9, 10 o'clock, he would be back in bed or sitting or watching TV, and he would get all his dialysis in, and his numbers were great. And he could still get up very early in the morning and go and attend his crops or whatever he did. And it didn't interfere with his farming life that much because we changed and modified his treatments according to his lifestyle. So from a patient's perspective, speak to your doctors, communicate with your doctors, let them know what your daily life entails, what's involved in your daily life, and can we tailor dialysis to your needs.
That's
I
great.
love that. That's what I went through. I wanna tell a little story about me. When I had my first appointment with my nephrologist, and, I was in the lobby, and this woman was there, and she was looking at me and said, "Are you a donor?" I said, "No, actually, I'm a new patient. My kidney's not working great." And she said, "Well, don't let them do this to you." And she showed me her fistula. And I didn't know what that was back then. It's almost 30 years ago. And, there wasn't the internet and everything to, educate myself about that. I just looked at it, and now I know that it was infected. Her arm was infected, but I was horrified, and I thought, "Oh my god, what am I doing? What's gonna happen to me?" So, I went into the exam room, and I was very upset. I was crying, and the nurse came in and said, "Well, what's going on?" And I told her what had happened. She goes, "Well, that's not gonna happen to you because you're gonna take care of yourself." And she took the time to ask me just a few questions about my lifestyle. And I was in media at the time, and I traveled a lot. And she said, "Well, there are some things that you may want to consider. Maybe peritoneal dialysis might be good for you." So I did manual PD for some time, and it really changed the course of my life. Those few moments of someone talking to me about the different types of modalities was super helpful. And so I think I'll parlay that into a question. So what's a simple way to start the modality conversation, like in center versus home, and what are maybe some questions that help patients compare their options without drowning in all the details of dialysis?
So first of all, we try and do it early. Discuss dialysis early so that it's not a shock at the end. Obviously, every way you're going to discuss it, it's going to be anxiety provoking, and patients do get a shock when you talk to them about dialysis because now I'm going to die. Now my life is going to change. Now, you know, all sorts of bad things are going to happen to me. And one of the misconceptions that I have, and maybe I hadn't explained myself as well as I should have, but even when I try and reflect on what I told the patients that they were not going to need dialysis now, they still think they're going to have dialysis now. And when you tell them to prepare for dialysis, it's a real big shock. And so I really try and spend a little bit of time on that. You don't need it now. We're just going to discuss it this visit, next visit, the visit after. We're going to discuss your options, and then we're going to send you to classes, and then we're going to discuss your options again while I take care of, your other issues. But it still creates a lot of anxiety. Some of my patients said, I don't want to talk about it. Well, let's put in your access. I don't want to put in the access because then you're going to start me on dialysis. So there are a lot of those kind of misconceptions, and I think it just takes time. And I think that's when family members are so important, having them in the room, because some of them will say, but he never said you were going to start dialysis now. What do you mean he's going to start, So people hear a lot of things that maybe you didn't say, or they misinterpret what you said. And it's not because they're not understanding, but because they're fearful. So they're fearful of the stuff you're telling them. And so you do hear things a little bit differently to when you're absolutely fearful, I think, to when you're feeling more comfortable and knowing that I'm not going to start dialysis now as part of my health and my life. I'm going to prepare myself for dialysis if I need it, if I can't get the transplant. So I think that's very important for patients to discuss with their doctor. When do you think I'm going to need this? How long after? And it's one of the most difficult questions for doctors to answer, but that's fine. Let them tell you you're not going to need it this year. You're not going to need it in the next, year or two. But, let's just think about it. And you can go look on YouTube. Is actually wonderful for access and things like that, and different modalities. But let's just open up that conversation without it being so anxiety provoking. And maybe, we, at least myself, can do a better job of just mentioning it once or twice and then gradually introducing that concept to patients. Medicine, of course, is a learning experience for doctors throughout their career, and we can always do better. And we should always try and do better and understand that, some patients can accept that and some can't. I mean, I've even had families who will yell at me, why did you discuss dialysis with so-and-so? Now they can't sleep. Now they can't eat. Now they can't. Well, geez, they're going to need dialysis pretty soon, and the families don't want me to discuss it with them. Then I say, you know what, why don't you come in? This is a phone call. Come in and let's all discuss it together. So you need the support of family with patients with chronic kidney disease, and especially as you move forward to dialysis and transplantation.
First of all, how could anybody yell at you, Dr.
Oh,
Boiskin? No, I can't even imagine.
I can do it.
there we go. That's Jean Marie.
Do you have this kind of a weird question, but so what kind of changes would prompt somebody to contact their care team rather than waiting for their next visit? So maybe they were told they have kidney disease. What are some things that people should watch out for that are maybe, they're surprised, first of all, that they do have CKD, but what are some of the changes that might happen in somebody that they should contact their physician before their next visit?
Well, maybe this is not a direct answer. Certainly, if their doctors tell them they have chronic kidney disease, but I used to find that doctors would refer their patients much later. So the creatinine only looked marginally up, and one has to know how to interpret the labs. It's not always that easy because it depends on a number of different things. And now that we have EGFR calculations, I think doctors are picking up on abnormal kidney function sooner. EGFR is not perfect either. I think it's a 30% variation in what your true kidney function is, and even EGFR. So I tell people to look at trends. And often when doctors will see a creatinine of maybe 1.1 or 1.2, in the low level, they say, oh, your kidneys are fine. But they may not be, because your creatinine may have needed to be 0.6. Well, I've always been within the normal range. Well, the normal range is a population range. It's not your range. It's the range of a population. So they need to understand that a lot of those normal values are taken from population studies. And then I say, so which one in the population is you? Well, let's sit down and work that out. So once again, these have to be individualized. Today, mostly, I see patients who have no symptoms, of chronic kidney disease because their doctors are picking up on it earlier and earlier. And even if we just have one consultation, and I'll see you back in 4 to 6 months after we've got the initial studies and data on you, might be all you need to have patients aware of it, that they have chronic kidney disease. And most are not symptomatic with anything. Certainly, if you have severe cardiac disease and it's affecting your kidneys, that's different than you have cardiac disease and you have symptoms from the cardiac disease. But for the most part, people will not have any symptoms at all. And I will often get that. How can you tell me I have chronic kidney disease? I always say, how can you tell me I have chronic kidney disease when I pee? How can you tell me I have chronic kidney disease when I don't feel anything? I don't feel any pain. Say, well, or I have back pain, so my kidneys must be a problem. No, back pain is usually back pain. So not all back pain is kidney pain. In fact, it's not that common to find kidney pain as the cause of, or back pain that's kidney pain, or kidney pain that's back pain. Well, what I want to say is you don't have to have pain when you have chronic kidney disease. Most kidney diseases, you do not have back pain or any symptoms at all. So the most important thing I think with that is that once you start, maybe even in your 30s, maybe your late 20s, start having your blood work, start having your blood test, go for your maintenance evaluations, go for your routine screening studies from a fairly young age. Once again, not because you have a problem, but because we'll have a baseline. I have patients who come to me for the first time when they're 50 with just marginal abnormalities, and no one has any idea how long they've had it. Maybe they had it from their teens, which would be very different than if this was a brand new finding. For example, you got blood in your urine. Well, I've had blood in your urine almost my whole life. Well, that's very different to, I've never had blood in my urine. Now I have blood in my urine. The spectrum of diseases that cause each one of those things are vastly different. So if you've had that diagnosed from an earlier age, it can be a lot easier to understand what you have and your workup of a patient like that. So once again, mostly you do not experience pain, blood in your urine, foamy urine, or any of those classic symptoms, swollen ankles, high blood pressure. Yes, absolutely, you can have all those symptoms and signs. Certainly, that once again, at your yearly physical exams, they will check your blood pressure. So that will pick it up there. You'll have your blood tests, you'll have your urine tests, and hopefully they'll pick it up before you have any symptoms of chronic kidney disease. Because once you're experiencing your uremic symptoms, your disease is very far progressed. And there may not be as much that can be done for you with regard to preventing progression of your kidney disease at a late stage versus picking up at a very early stage.
I wanted to jump in and go back really quick. If you wouldn't mind explaining what creatinine is and what EGFR is in layman's terms.
Sure. So creatinine is a way we estimate kidney function. It's a long way from being perfect. It's an estimate. It's easy to get a test like that. You just get a blood test, and it's quick and cheap to analyze the blood for creatinine. Creatinine really comes from your muscles, breakdown product from your muscles. So if you've got bigger muscles, smaller muscles, taller, shorter person, then your creatinine can be very different with the same kidney function. GFR is more accurate way of estimating kidney function. So GFR is a calculation of the creatinine. So it's not a measurement, it's a calculation. The measurement is the creatinine. Certainly if you take creatine, that can affect your creatinine level. Creatine can be broken down into creatinine. And I think the labs we do don't differentiate between creatine and creatinine. If you're a bodybuilder and your creatinine is slightly higher, does not mean you have kidney disease. You've got bigger muscles and you take creatine. So once again, you have to look at your patient. You've got to look at your patient and analyze the information you are getting from the labs with respect to your patient. A creatinine of 1.2 for a young, healthy, physically active person is very different to a creatinine of 1.2 for someone who's 98 years old and who's wheelchair bound. So creatinine doesn't always mean the same for everybody. And it needs to be, you need to sit down with your doctor to interpret your blood tests. Don't go look on Google. Talk to your doctor. I want to talk a little bit about protein because it's one of my,
Cool.
and it's one of my favorite topics. Well, it's, about protein restriction. Every doctor has their likes and dislikes, and you got to restrict your protein. Well, how much? How much do you have to restrict it? Well, I guess, and then you tell a patient, do you really want to know? And some of them want to know. So you say 0.8 grams per kilogram. Well, what does that mean? You're going to Ralph's and you're looking at a steak or you're looking at a piece of fish. How much of it's water? How much of it's skin? How much of it's bone? How much of it's sinew? It's very, very difficult. So, certainly dietitians are very helpful in helping us with patients. And they say, well, what about all proteins the same? No, they're not. Proteins are all not, they are not all the same. And then I say restrict animal protein. And then the next question is, well, what about fish? And then I smile and I say, well, let's see, is fish a plant or an animal? So I try to not to say that anymore because I understand what they mean and they're actually absolutely correct. I'm just being, hopefully it adds a smile to your face and to mine, but your question is absolutely appropriate. All protein is not the same. Red meat appears to be the worst, and certainly processed red meat seems to be worse than anything else. White meats, now pork is not white meat. Pork is just as bad as red meat. So that's not a substitute for red meat. Chicken, yes, chicken seems to be fairly neutral as far as accelerating the loss of kidney function. But then it depends on how you prepare the chicken. So if you're going to put barbecue sauce all over it and it's going to have sugar in it and it's going to have salt in it and it's going to have other fats in it, you're not doing yourself a favor. You're fooling yourself. Why do I think that? Because we all fool ourselves. I fool myself. We all think we're eating healthily, right? I eat a lot of salads, but then I pour salad dressing on it. Well, geez, maybe it would have been better if you didn't eat all that salad. Well, we understand what I mean. Obviously, I don't want to discourage anyone from not eating salad or vegetables, but it really depends on how you prepare it. So white meat appears to be fairly neutral as far as accelerating the loss of kidney function. Fish, I understand why the question comes up with fish, and my patients are absolutely right. Yes, fish is good for you. Fish has got omega-3 fatty acids in it, and it certainly does not accelerate the loss of your kidney function. So why is red meat that bad for you? Well, you're going to form a lot more urea toxins in your body. Your kidneys may not be able to get rid of it. It might be high in phosphorus. You're making more acids. So plants are usually alkaline. So you're not forming those acids, and acids are not good for you. Your body works on enzymes, and if you start messing with the pH in your body and you'll use your bone for buffering, you'll get bone disease problems. You might develop protein deficiency problems more readily if your blood is more acid. So, try and limit, especially processed meats and red meats. And if you want to have fish and chicken, fine. Just be careful how you prepare them. Vegetables is still the best way to go if you're vegetarian.
Let's go back to pork really quick. Why is that just as bad as red meat? Because I think we have been hearing, they had great marketing, right? Pork is the other white meat. So why do you say that pork is just as bad as red meat?
Well, whoever said it was better? And telling you that it's the other white meat is marketing, but they don't say it's better for you than red meat. So listen very carefully to how they market it. They didn't once say it wasn't as bad as red meat. They called it the other white meat because it's lighter in color. So you have to be very careful with marketing because you're reading into it that it's better than red meat. But they never said that. All they said was it's the other white meat.
But why is it that, look, I want to protect a little marketing because I'm a marketer, but no, but why is it though? Like, what is it about the pork that makes it just as bad as red meat?
Well, it was a study or data I saw a long time ago. And why shouldn't it be? It comes from an animal. Why should it be any better than red meat? I guess to me is the first question. And so already you've listened to the marketing on white meat. Who made up that it was the other white meat? They made that up. And you, of course, felt that it's not as bad as red meat. But from
Yeah.
the data I saw a number of years ago, there's no data to support that at all. Where's the data that shows that it's not as bad for you as red meat? And from the information that I've seen, it's the same. There's no difference.
And it also affects your heart, right? So going back to the top of the hour,
Yes,
the eating red meat a lot can affect your heart too, right?
absolutely. Absolutely.
If I feel okay, my kidneys are okay.
Absolutely not. And that's why we can go back to your to your yearly evaluations and your yearly checkups with your doctor. Very important. You can feel absolutely fine. And I've seen many patients. I've been healthy my whole life, and now you tell me my creatinine is so high. I say, not so fast. You have felt good your whole life. Doesn't mean you've been healthy.
Dialysis means you failed.
Usually what I tell my patients is you only fail when you stop trying. Anyway, that was just brought that to mind. No, absolutely not. Patients will tell me that I take all my pills, I control my diabetes, my blood pressure is well controlled. Why am I ending up on dialysis? What we've been stressing to patients is you've slowed down the progression of your kidney disease. Dialysis was inevitable. What you have done is you have kept yourself as healthy as possible and for as long as possible, preventing dialysis. It doesn't mean you failed when you end up on dialysis. There's certain things you can't change. There's certain things you can't change, but you can delay the onset of end-stage kidney disease and get to end-stage kidney disease much healthier than you otherwise would have reached that point. Doesn't mean you failed.
There is only one right choice of dialysis.
Yes, there is only one right choice, and that's the choice you want. What
I knew you
you
were going to say
want.
that.
Yes.
I
So
knew it too.
that's why education is so important, and patients need to know what's better. And I say, well, let's sit down. Let's listen. Let's look at your lifestyle. Let's look at your support at home. Let's find out what's the best dialysis for you and what you want. So what you want and what be this will and the safest and the best for you is the right one.
I should wait to plan until I'm really sick.
Once again, it comes back to symptoms. What symptoms should I look for kidney disease? And I said, well, start seeing your primary care doctor early in adulthood, because mostly you will not feel anything. Once you feel sick from your kidneys, you're probably very far advanced and you already have a number of complications: accelerated hardening of the arteries, bone disease, you may be more anemic, your blood pressure may not be that well controlled, you're putting your heart, you're putting your brain at risk, maybe your feet, your eyes. So if you have waited until you're symptomatic, because if I'm not symptomatic and because I feel fine, that you are fine, that is not always the case.
Asking questions will annoy my doctor.
Find another doctor. You should ask questions. Sometimes if it's, oh, I'm really sorry, I thought I'd brought that up, or I wasn't thinking along those lines. And now that you've mentioned it, let's discuss it. So absolutely ask those questions. If it's creating anxiety, which is so destructive, and your doctor doesn't answer it, maybe they can't, maybe it is not known, that's also fine. If it is not known, well, you don't know. But if you know that it's not part of your kidney disease and it's something else you should look at, that's a good discussion to have. And then you move on with other things that are directly important to your kidney disease. But you need to ask those questions.
Last one for the lightning round. I can't bring someone with me or ask for notes.
You should bring someone with you and you should ask for your notes. And now patients have access to their online portals where they can see their notes. But some patients don't, or they don't have the ability. Some patients don't have computers. They don't know how to use computers. Then they should ask their doctors to print it up for them and maybe send it to them in the mail. And when in that situation arises in my office, I often will say, well, I haven't finished my note. I'll probably only finish it later today, but can I print up your lab results for you and make some notes on their lab results? And I think that's great. And then the patients have that, and then they can track their lab results with you. Your chart notes are your patient's notes. They belong to your patient. Never think that your doctor's property. They are not. They are your notes, and you should have ready accessibility, or it should be readily accessible to you anytime you want them. And patients need to understand that as well. They are part of the treatment plan.
Thank you for saying that. What would you like people to take away from our conversation today?
Make sure to ask questions, be an advocate for yourself. Your is part of your team. It's the quarterback. No, you're the quarterback. I'm the quarterback.
It's
The nephrologist is just the kicker.
What do
That's
you
all I
think
got.
about that?
It's all you got. What I'd like them to take away is, yes, you're a team. You should have a team that helps take care of you. It's not just you and your doctor. It's family. It's friends as well. And if you're comfortable, have friends come in with you. This is not a journey that you should be taking on your own. Sometimes maybe you have to. I mean, we all have different circumstances, but we all need support. And when you have chronic disease, you may need more support. And to have loved ones and people who care about you with you going through this very difficult journey and making it less difficult and easier to go through that experience, I think is very, very important. Stress and anxiety is a subjective thing. It's not an absolute. So if you have stress and anxiety and you have loved ones in your life that can go through that journey with you, they can reduce that anxiety. And hopefully your life can still be enriched in many different ways, and you're not bogged down in your underlying chronic disease, and that you can live as normal a life as possible.
Love that. So thank you. My thought is advocacy isn't confrontation, it's more clarity. And I would like people to remember to bring their questions to their care team and use ReMend peer support resources. Watch our videos, give us a call, email us, and see if you'd like to speak to somebody that's gone through the same journey that maybe you're going through, to just get some insight. It's always nice to talk to somebody that's been through it. But again, no one chooses the kidney journey, but no one should have to face it without information, support, and hope. So I want to thank both of you for participating today. It was a pretty cool session. I'm very excited about our discussion. Thank you both so much.
Thank you very much.
Ta-da!
Thank you, Kiko. Thank you,
Thank
Julie.
guys. That was awesome.
Thank you.
Thank you, Dr. Boiskin. Now I'm sad you're not my doctor, but at least I know you.
Oh, so sad. Sorry you missed out, Kiku.